All right. So, thank you again for expressing your interest in our Health Reboot program. My name is Dr. Assam, and I am the founder of RopheMD. I'm going to walk you very briefly through what our 4-week Health Reboot program entails. So, the 4-week Health Reboot program is an intensive program. This program is going to teach you relevant principles about disease prevention and disease reversal. A lot of what we will discuss will involve lifestyle interventions. There will be no medication prescriptions during this 4-week time. And this is all going to be rooted in biblical principles. There are a lot of results which patients have experienced. For several patients, it's looked like weight loss, losing an average of 10 to 15 pounds during the 4-week period. Longevity is another factor that has come up as a result. Preventing chronic disease, for example, those who have a history of high blood pressure in the family, diabetes in the family, or those who have already received these diagnoses themselves, now having a reversal of these chronic conditions. For patients who even have other conditions such as migraines, fibroids, we've had these conditions completely eliminated at the end of the 4-week program. I think it's very important to know who you're speaking with. And in medicine, this tends to matter quite a lot. And so I'm a board certified family medicine physician. I trained at Georgetown University Hospital and Washington Hospital Center, the leading hospitals in the Washington, D.C. area. I also completed a brief fellowship at Harvard and Beth Israel, studying dignitary protective medicine and disaster medicine, which really equipped me to now be able to take care of the elect of God and of government that I really care deeply about. I worked in the business world as a management consultant for a firm called McKinsey and Company. And in this role, I helped life sciences companies and healthcare companies solve very challenging business problems which they were having, several of which were Fortune 500 companies. I went to school for medicine in New York. I studied at SUNY Upstate Medical University. I obtained a master's of public health at Johns Hopkins, Bloomberg School of Public Health, and I obtained my Bachelor of Science in biology and French at SUNY Oswego, also based in upstate New York, where I graduated magna cum laude. Bringing it right back to RopheMD. So, what is our vision? What are we trying to do here? We are aiming to educate the world, literally millions, about biblical principles that help us to optimize our health, help us to live long lives. I have a personal desire to have every single person who goes through this program and who I serve as a physician live well up to 100 years, and not just live any type of life, live a good quality of life. But the truth is, we need the knowledge to be able to do that. And the Bible tells us in Hosea that we are destroyed because we don't have knowledge. And also it says specifically about the priests that the priests also do not know the laws and do not share them. I see myself as a vessel that God has chosen to now be able to impart this information to the rest of the world. And so, what does the 4-week program entail? It's a virtual program, and it it's a program which was designed by divine inspiration. There is a daily devotional, which it comes with. It includes therapeutic fasting, which is what the program actually starts off with the first week. And then that leads into a detox for the second week. In the third week, we implement a meal plan. And in the fourth week, we solidify all of the habits and all of the lessons that you've learned throughout the program. Because we know that it takes at least 21 days to form a habit, the plan is by the end of the 4-week program, having beyond 21 days, you would have established new habits that will carry well beyond the program. And my personal desire as a doctor is to make sure that you feel empowered, you feel equipped, you feel ready to take care of your health, and you don't need me every 2 seconds because you know the information. You're going to become an expert in your own health and in your own body. My job is to simply be the teacher. Now, this is just a summary again of the program. Um, the First week, it starts off with a 5 day dry fast. I encourage people, if you're able to go through really with no water, that's going to push you to get the most optimal results. Now, for some people, based on what they have going on in life with work and other life circumstances, that's a bit challenging. And so, if it's easier to have water incorporated, that's okay. And the reason why we start off is because this allows your body, your immune system specifically, time to reset, time to really detoxify. And then it's followed by a raw fruit and vegetable detox. It goes into a meal plan implementation. As I mentioned in the last week, we're solidifying all of the behaviors that we've learned throughout the time. Now I want to go through what three of my previous clients have shared. Our first client is Sarah. And Sarah said she lost over 20 pounds during the program. She was in her last week of the program when she gave us this feedback. And she said, I'm still keeping the weight off. This isn't a diet, but it's a lifestyle. Also, she was able to accomplish her goal of overcoming her flesh rather than having her flesh overcome her. She gained the fruit of the Spirit, which was self control. She found that the tips and the advice provided were very helpful in her reaching her goal. 4 months prior to the program, she weighed 286 pounds, and at the time, she weighed 261 pounds. She felt like this not only impacted her, but extended even beyond to break generational curses of gluttony and obesity. Now, Sarah, since then, has actually lost well over 30 pounds, and she's been keeping this weight off. Renee is our next client. So she lost 12 pounds during doing the fast. And one issue that she had was actually having daily migraines. She was so nervous about participating in the program because of these migraines and because she would need coffee or something to eat to help her feel better. But after the fast, she now realized that she wasn't dizzy, and she certainly was, she was less dizzy, and she wasn't having migraines at all anymore. She also felt like the fast helped her build her spiritual capacity. And the last client I want to share feedback from is Abigail. Abigail lost 13 pounds in total during the program. She shared her feedback at the end of her program. And she said she developed discipline during the time. And she could really notice that God had given her specific instructions about what foods he wanted her to eat. And she said, if followed, simply put, it works. It is truly guided by the Holy Spirit, and so it has to produce results. And I appreciate this feedback because truly, it really shifts the focus for me back to God. This isn't a program I just thought of on my own. I can tell you that. This is something that I really sat with God in extensive times of prayer. And this is the download that He gave me. And it's still going. And He said, she said, this is transforming individual lives one at a time. So let's wrap. It's 4 weeks long. It's self-paced. You're going to have me as your doctor on demand. And the best part is you can start today. So that's the information I wanted to share with you. I'll pause here and see what questions you might have, and we will go from there.